Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Surgery in genitourinary tuberculosis. In surgery in genitourinary tuberculosis, the optimal time for surgery in genitourinary tuberculosis is 3 to 6 weeks is the best time for surgery of genitourinary tuberculosis. That is 3 to 6 weeks after ATT started. ATT is started, then after 3 to 6 weeks you can do surgery. Then, what are the procedures of genitourinary tuberculosis? For genitourinary tuberculosis, one, in genitourinary tuberculosis, you will see presence of ureteric strictures. So, if there are ureteric strictures, then you should introduce the dilators into the strictured part, and you will have to dilate the ureteric strictures. And this ureteric dilatation will offer almost 50% chances of cure in cases of ureteric strictures. Second, you can do if there is pelviureteric junction obstruction. If there is pelviureteric junction obstruction, then you have to remove this part, and you will call it as pyeloplasty is done in case of pelviureteric junction obstruction. If there are bigger ureteric strictures, if there are smaller ureteric strictures, you can do dilatation can be done. But if in case there is big and bigger ureteric strictures, in such cases you cannot do dilatation. So in such cases you should remove this part of the ureter, and then you should first remove this part of the ureter, and then you should transpose bowel transposition can be done, or you can use a Bovary flap operation. In Bovary flap operation, if the ureter is in the lower part and if the stricture is in the lower part, then you can, if the stricture is here, think that the stricture is here. Now with the help, you will have to remove this stricture, okay, by surgery. And now this bladder is refashioned into a flap, and this is anastomosed with the ureter. This is Bovary flap technique, which is done for ureteric strictures. Then you can also do augmentation or substitution cystoplasty can be done for bladder stricture. Now if there is a stricture in the bladder, you can remove the stricture and do a substitution cystoplasty can be done. Then if it is a non-functioning kidney, if the kidney is not functioning, then we do not need that kidney, right? Obviously we will have to do a nephroureterectomy if the kidney is not functioning. Second, if there are polar lesions means if the lesions are present only at particular site, like for here only the upper pole of the lesion is involved. In such cases you can do a partial nephrectomy and remove this part of kidney. Only the treatment of partial nephrectomy is done if the patient is not responding to anti-tubercular therapy.
thank you and thank you for watching.